Hey, everybody. Welcome back for part 2 of my podcast with Dr. Aakriti. So much information coming your way. If you're popping into part 2 and you haven't listened to part 1, I think it's okay. But just know that there's a treasure trove of information in part 1 and part 2. Thanks and enjoy. No, no, not one bit. And you know what? By the way, at the time, right before I did all this, I think between the L4, L5 bulging disc incident, which now I know I probably had that bulging disc. You know, that bulging disc was probably not the result. I mean, not the cause of my pain, but that's another whole podcast.
That's a whole nother story. And right, I can go 100%.
But those little things had come out. They weren't urinary pads. They were the insertables. It almost was like a
poison pressa.
Yeah, yes. And all of us in the gym, all of us in the CrossFit gym, who were all 40s, multiple kids, had those. And we'd like, it was like middle school tampon girls. Like, you got a tampon? No, you got. I called it scaffolding. You got any scaffolding in your? I did. And we use those all the time, and then when I did my physical therapy and my urinary incontinence just went away, I was like,
yeah,
did not know. And there I was with a nursing background. And clearly, thank you for acknowledging my vulnerability. And some of us are less private than others. I don't have a lot of private bones in my body. Okay. Yeah. Yeah. So, I was telling everybody about it all the time. It wasn't like I wasn't saying to healthcare practitioners and or friends and or coaches and or mentors, like, I'm peeing in my pants. I was very vocal about it, and it still took me
a decade almost.
Long.
Yeah. And isn't it wild? Like, that a lot of it was just lifestyle modifications and breathing techniques and learning how to regulate your nervous system, calm down in your day, and that can fix your incontinence. Like, I had someone come to me last week. I've been working with her for 3-4 visits. Just, it's only been like a month and a half working with her. And she was like, I can't believe, because she's the one who would like leak all the time, making it to the bathroom, cough, sneeze, and it'll be a wet pool under her pants. And she was like, I can't believe, like, just like little things like decreasing caffeine, counting my pee, not just in case peeing, doing a couple of like pelvic and core like strengthening exercises. I'm not peeing at all anymore, not once. And you did not even do an internal examination on me. Yeah. I didn't do. You do not need to get that biofeedback. You don't. An internal exam is never, ever necessary or mandatory for you to get better.
Now, okay, so I want to know about this. I did get trained with my physical therapist on how to use that internal wandy thing. I did a couple of things that made me, as a, married middle-aged woman, a little bit uncomfortable. Yeah. I got those little balls that you can put into your vagina that are the weighted balls.
Yeah.
And I'd put those up there, and I'd practice doing double unders with those in. And feel, how that felt to sort of have to hold that ricocheting ball inside my vaginal canal. Yeah. And I also did a wand, so if you're listening, it looks like a little lightning bolt shape.
Like a little S shape.
Little S, yeah. Plastic, hard plastic. And my physical therapist drew out a map for me of my innards and said, okay, this is where you're going to hit a bone. Don't hit a bone. That's not going to feel good. And look for those knots. She said, you can work the knots out of your hips and pelvis from the internal side, just like you can foam roll them from the outside. So how do you feel about all that? And what are your thoughts on internal work?
Yeah, that's a great question. And some people may not agree with me on this, because my stance is it's never necessary to do internal work. For some clients it may be, but majority of my clients no, because a lot of people have a history of trauma, or like there's a lot of stuff that's happened to my clients, and doing anything internal will re-trigger them, or even doing it to themselves may trigger them.
Yep.
So for a majority of my clients, we don't even need to do internal work, and you don't even need to like internally release a pelvic floor muscle, because the pelvic floor, it's reactionary. I like to think of it as a scapegoat. Okay. Why is that muscle tight? I mean, you can keep releasing it, but it's going to come back, right? It's keep coming back because why is it tight? Why is it coming back? What is it telling you? What's outside of the pelvis, or what's other muscles connecting to the pelvis that's making the pelvic floor so tight? And we need to address that, and the tightness will melt away automatically. We blame
so I love it. I love it that you said that, because you mentioned a lot on your reels and whatnot, your like nervous system and your stress level and all that stuff. And also, I'm a big believer in energies.
Yes.
In energy work, getting stuck spots in your body. And when you hear, when you say the pelvic floor as a scapegoat, and we know that there's a lot of people who have had trauma, a lot of people who have had trauma. What are your thoughts on that whole energy thing?
Oh, 100%. I believe it. I get acupuncture work done myself. It's changed my life. Like I've done some recall healing stuff with a friend of mine who's certified in that. I've done like body code. Like I'm very familiar.
I love the body code.
Yeah,
love
really,
the body code.
It's so interesting and fascinating, and it works. I mean, I come from an Indian background with my grandmother. She will, like, you know, if there's too much like negative or evil energy at me, like on me, she will do a thing to like get rid of my nazar. We call it in Hindi. It's like she gets rid of my nazar, like that energy. And so I'm a firm believer in energy work, but like think of the pelvic floor. Like if it's holding on so tight, like why is it holding on so tight? What else are you holding on in your life that you're not letting go, right? What are you holding on to? What are you not releasing? So you can't release your pee or poop.
Yeah. Oh, I just love that. And to be clear, what I love is that I do not love holding on to negative, stressful, scared energy in my pelvic floor. I do not love being constipated. I love that we are saying this out loud for people to hear.
Yeah. Yeah. I've had a client who I taught her how to first breathe into her posterior rib cage, because no one can breathe in that area. Because right, like our lungs are 360, our diaphragm is 360, our rib cage is 360. We focus too much on our chest and diaphragm and nothing in our back body. And then we taught her how to set boundaries in her life. Why is she people pleasing? Why is she like extending herself? Why is she not doing anything that brings her joy? Pelvic pain disappeared. We didn't like do internal work.
Yeah. Oh, you did internal work. It just wasn't that kind of internal work.
Right, exactly. Like the internal emotional work we do, like it also helps our pelvic floor. Like there was a study, I can't remember the exact one, where they put people in front of like a movie where they see a traumatic car accident and see where they hold on to that tightness in their body. And right, we always think our traps, right, our neck and upper traps, that tightened, but so did that pelvic bowl. That also holds on to that energy of like.
Is that where we get that expression? So I always say, and I know I heard it somewhere, like I didn't make this up, but I always say like, oh, that's got my butthole up in a squanch.
Oh my gosh, the amount of people I have to tell to let go of your booty hole or just breathe into your booty hole is probably on a daily basis. I need a sticker that says breathe into your booty hole. If someone wants me to make me that sticker, I would love that. We are clenching there so tight.
All the time.
all the time. But also, like, I'm clenching now. I realize, like, wait, why am I clenching? And then also, as like women, we also suck in our belly, suck in that abdomen. Stop sucking in. Stop clenching your butt, booty hole, and your abdomen. Let it go, and your pelvic floor will thank you.
Yeah, yeah. They did tell me, they were like, Amy, your pelvic floor is all, and especially like you said, that trauma of I never know when I'm going to pee. So my pelvic
Mhm.
floor is always just trying to hold as hard as she never like relax and go, except with orgasm, you
Yeah.
know, and then that was another thing that I read when I was very first learning about my pelvic floor health was it all those hormones that are released when we orgasm
Mhm.
so good
Mhm.
for stopping our urinary incontinence.
Oh, I've given people like an orgasm a day keeps the doctor away. So I'll tell that just like work on arousal, work on like orgasms, like work on like self pleasure. It can be so lovely for your pelvic floor. But when we think about like that holding on, because you don't want to leak, right? Think of
Yep.
the if you're familiar with the length tension relationship in our body and our muscles, right?
No, I'm not familiar with that. Say it again. Well, sort of, kind of, but say about that, please.
Yeah, like the length tension, right? So our muscle, it shortens, it also lengthens. When we hold it in a tight, shortened position and we have like a sneeze, cough, or a pressure, it's not able to have that reaction of tightening and like keeping it there because it's already too short. It needs to have that like nice, stable, lengthened position to engage to stop that pee and poo. So if you're always holding it so tight, there's nowhere for it. Like it can't hold
Oh,
on.
yeah.
You're doing the opposite thing you want to do.
Yeah. Somebody demonstrated that with me one time. They like took my arm and like held it here and they pulled against it and I couldn't hold it,
Mm-hmm.
but I could pull it up. It was a
Mm-hmm.
weird, it's like if your muscle is at like a 50% tension, I'm making this up, but for example's
Mm-hmm.
sake, a 50% tension state all the time, that when it needs to go to 100, it can't go to 100.
No.
It can't get there. But if it flows between like, oh, I'm totally relaxed and lengthened at a 0, and then I can go to 100, and then I can go to a 50, and then I
Mm-hmm.
can go back to 100, then I go to a 0. But it's got to be in that flowy state. And so many times with the stress level, and then you're really stressed because you peed in your pants and you don't want to pee again, and you're terrified. Then that little pelvic floor just is always like on the on guard state, and it can't really come to the rescue.
Yeah, but also your pelvic floor, but your abs, your booty hole, your jaw, your whole
There.
body ends up becoming really, really stiff. Yeah.
Yes.
And you can't react to anything because you're so stiff. Like, think if you were like
Mm.
clenching your jaw and clenching your biceps and someone threw a ball at you, you're not going to be able to catch it. But if you were in that flow state, like relax, like, oh, cool, I can catch it. Like, I see it coming, right?
I love
Like,
that. Yeah.
yeah.
I just heard total side note. We went to the batting cage for the first time the other day. We've been saying that we wanted to go to this batting cage for like months. And we went to the batting cage, and I haven't hit a softball since I was probably 17. So it's been quite some time. And I did all right. But, you know, I got in there and I was like wound up. I was like holding it right here so I could like flip. And then this other woman comes in. She's 28 and she clearly has a lot of softball experience, right?
Mm-hmm.
And I hear her talking to the little kids because my oldest and I were doing this, and she's like, "Yeah, mom, it's pretty the same as it always is. It's just me, you, a bunch of little kids, and then the professionals, you know."
Yeah.
But we hear her talking to this little kid, and she's saying, "Yeah, you don't want to be tight while you're waiting for the ball. You
Mm-mm.
want to be loose." And
Mm-hmm.
just like that's a newness for me. That's
Yeah.
a learning for me. So I've been thinking about that all week. Like, so you want to be in the batter's box, ready but loose. And
Yeah.
now here we are talking about you need your pelvic floor, your abs, your booty hole, your clenched jaw, your big old traps to be in that ready state, but not turned on.
You got it.
Oh
You got
gosh, well, And then there's the practice of undoing all the conditioning that we have and all the
Oh,
fear.
yes.
And that's where you come in, isn't it?
Exactly. Because everyone needs, I like to say, like, so I have a problem with a lot of Western medicine and how doctors practice in the US because we just tell, and force. And that's not how the body works. So I believe when I'm with a client, there are two nervous systems in the room, mine and the client's. If they don't feel comfortable with me, I don't feel comfortable with them, or there's something off with their energies, they're not going to heal. So I'm always like, meet your clients where they're at and never tell them to do anything, but ask questions and figure out where they are in their life, because I am more of a coach and a guide. My clients know more about their own bodies, right? More than I would ever know about their bodies, right? Because you're a person, right? You're a mind, body, spirit. You're everything, not just the muscles and pelvises I'm like assessing. You're a whole person.
You're not just the pelvis.
Not
That's another bumper sticker. You are not
just the pelvis. Like I tell people, hey, like I do pelvic floor work, but I'm looking at your jaw, I'm looking at your rib cage, I'm looking at your feet. We're looking at everything. But I am a guide and a coach. Like I can help you through this journey you're in, because people need accountability. They need education, like maybe an exercise program, but that can change like as we go through the months of working together. But in those months of working together, it's a two-person thing, right? My 100% is only 50% of the relationship and vice versa. Like I need the input from my clients. I need to see where they're at in life and adjust as we go. And when I like had to have my own like physical therapist, I can't heal myself. I need someone looking at me with an objective lens to see like, what am I doing? How am I moving? Like all of that. So I feel like everyone needs like someone else looking at them objectively.
No, I love that. I was going to say, yeah, because the job for me when I'm coaching, like same thing. I know that you are the expert, and for all that I know about
Yeah.
all my life experiences, about trauma, about marriages and divorces and pregnancies and childbirth and CrossFit and nursing, and like I've got a boatload of knowledge, and really it doesn't stand center stage. If anything, it's way back in the wings, because my best job is helping show an objectivity that then you, the client, can receive and interpret with all your knowledge, because that's where the juice is. Okay. It's not over here with me.
No.
I'm just the question, the mirror, I'm just the one who's digging. You got to look at what we're digging up and decide what to do with it.
Exactly. I love that analogy. Yeah.
Yeah. Yeah. You can tell when I talk to people who do the same thing that I do in the same sort of theoretical underpinning. It's an interesting conversation because it's a good paradox to live in, right? Like it's totally who I am, and also it has nothing to do with me. It's all you, girl. Yeah. It's fun, isn't it? Okay, so we talked about the peeing in your pants. When I said to you, what are the three things that you really want to make sure we talk about? You said the urgency, frequency. You said the dribbling, and you said the pain on sex. So let's talk about that a minute, because we haven't really talked about that.
Yeah.
So, and I've never experienced that. That's probably why I saved that till last. So this is a new thing. I'm hoping you can shed some light on when that happens, why that happens, what can we do about that? How would people know? How would people know, and who would they decide to go to?
Yeah, that's great. And I mean, this can be a whole nother topic of conversation as well. I think a whole hour long. So I'll try my best to kind of summarize it a little bit. But pain with sex, it can be many different things. It could be like back or hip pain with sex in different positions. It could be like vulvar clitoral pain. Maybe there's some burning in that area with touch. So that's actually called a vulvodynia, or vulvar pain. There's also clitoridynia, like a more like clitoris pain. There can be pain with any sort of insertion. And that could be many different things. It could be the glands in that area. It could be the pelvic floor muscles in that area. And it could also be deeper pain. So like with sex, if it's like too deep, like you can have pain deeper. I have some people say they have a lot of like abdominal pain with sex, because like those muscles are all connected, abdomen, pelvic floor, everything. So it could like encompass like all of that. It could be pain with arousal, pain with orgasms, just not having any pleasure with sex. That could be something as well. And a lot of different things can cause it. It could be past history of trauma. It could be shame and guilt. It could be our upbringing on how we view sex. It can be injury, right? It could be a back injury, a hip injury. It could be a labral tear. It could be like, all of that. It could be
I giggle because my children tell this one story that my oldest was climbing up on the tree house that we had at the house. And it was that yellow nylon rope grid, that yeah. And I was at the minivan at the top of the hill at the backyard, and I saw her just straddle that nylon rope. I mean, she hit it so hard. And I ran down the hill and, nurse, ripped those britches down and just opened up that vagina, and she had a good, red mark there, but she was fine. But the way she tells it is just so funny. The way she's like, remember that time you ran down the hill and ripped down my pants when I fell on the line? Yes, I do. Because traumas happen. And I probably did that because I'll tell this story too. When I was about 10, I was on my bike. And you know how when you're 10, you just have these like, well, I wonder how that would work moments. So I was like, I wonder how blind people ride bikes. Well, blind people may not ride bikes this way. So I close my eyes and I ride my bike right into the wall beside the garage. And what happens? But I slam off that banana seat in, 1982 and ram my pubic bone into my bike. And I can remember, I remember it hurting. And I can remember my mama looking at it and telling my granddaddy about it. And not in a traumatic way, just in it was a big thing, apparently. So maybe that's why I flew down that hill so fast and ripped off her drawers. But it happens. It happens. And it can happen at any age.
You got it. Yeah. I have clients who the first time they've had sex was after marriage, and it's so painful. And because it could be, their perception of sex, but I also ask questions like, do you have pain with pap smears? Do you have pain with did you have pain putting a tampon in? Because those are early signs of pelvic floor dysfunction.
Huh, really?
As early as not being able to put a tampon in, that's a sign of pelvic floor tightness. Yeah.
Okay, so I love this, and you can dispel this myth. So when I first lost my virginity, didn't hurt at all. When I first needed a tampon, didn't hurt at all. I always ascribed it to, because my parents were very much like, sex isn't a bad thing, but don't do it until you're married, right?
Yeah.
Which clearly didn't happen, but that's okay too. But I also grew up a dancer. So I spent a lot of time in my body, and I spent a lot of time legs spread wide. It wasn't a gross thing. It was a very normal thing for me, very flexible, very limber. And so I think I had this misconception in my head that, well, if I'm limber it's not going to hurt when I have sex. Maybe when another girl has sex, it hurts her because she's just not as flexible. That's not true, is it?
No. The amount of people I work with, myself included, who are hypermobile, or they have like a connective tissue disorder, things like that. Like I've seen so many people have so much pain, like in their pelvic floor and with sex. Like I've worked with dancers, like you're overstretching sometimes. And then the pelvic floor is taking the brunt of that.
Oh, thank you for sharing that.
Mm-hmm.
Yeah. Okay. So if you're having pain with sex, it can be all kinds of different locations of pain. It can be different timings of pain. It can have different causes.
Yes.
What can we do to treat, and where should they go?
Yeah. I mean, number one is always pelvic floor physical therapy. That's number one. Another thing is I highly recommend like a sex counselor. If it's more of like pain with sex in like a marriage or something like that, or if there's a lot of guilt and shame around sex. So I highly recommend like sex counseling. I don't know if we have this in Hickory, but I used to live in Nashville, Tennessee, and they had a place where I used to send a lot of my clients who had more vulvodynia, like so more of a high end, like the nerves in that area are overactive. So I can do a lot with pelvic floor physical therapy, but it was nice to have like a nurse or a medical doctor that like stuff that's out of my scope to some people too, because they were Institute of Sexual Wellness. So they could prescribe like maybe like a topical or like some other medications to like help calm down that nervous system and the overactive nerves so they can improve with physical therapy even more. And so that was an option for clients in Nashville. But yeah, those three are probably what I would suggest the most: pelvic floor physical therapy, sex counseling, and a medical professional who has experience working with sexual health disorders.
So there's hope.
Oh my gosh, there is hope. You do not have to live with pain with sex. No, not have to live with that.
And you don't have to live with never having orgasms.
Mm-mm.
And you don't have to live with peeing in your pants or pooping in your pants or being afraid to pee in your pants or not doing any running, jumping, sneezing without the side twist.
Yep.
You don't have to ride your bicycle blind.
Nope.
There are so many things you don't have to do. There's really hope.
There is hope.
Yeah. Anything else you want to share before we wrap?
I think we covered a lot of it. I always like to iterate saying, don't make a healthcare professional do something you're not comfortable with doing. So if you're not comfortable with the procedures they're doing or the topics they're asking you about, you have the right to deny that. I always even like to tell my clients, like, hey, like before we get started, if we're doing anything or I'm asking something or we may do like some testing, if you're not comfortable with any of that, raise your hand, just like say something, and we do not have to do it. You are in control of your own body. So I always like to iterate that.
I love that. And thank you for being that for people. You know, we need to know that we are not only in control and empowered, but also responsible for our own healthcare journey in our own bodies.
Exactly. You have to get better.
Yeah. Yeah. You have to want it and you have to be in the driver's seat. Sometimes it sucks. Sometimes it'd be nice if somebody just said like, no, eat this way, exercise this way, sleep this way. That is not the way it works.
Not how the way it works.
It's not the way it works. So, okay. So lastly, I'd love for you to just share with our listeners where they can find you, how they can find out more. And we'll, of course, put that in the show notes too.
Yeah. So the best way to get in contact with me and kind of find out more about what I do is through my Instagram. It's No Pelvis Left Behind. And you can always send me an email at info@nopelvisleftbehind.com. I have a new office in Hickory. I think the address is 201 Government Avenue Southwest, Suite 303, Hickory, NC 28602. So that's where my new office is located. I do virtual work all around the world. You do not have to be local, and you don't have to be seen in person to get better. Yeah, that's
Oh,
me.
I love that. Awesome. So for those of you who are listening to this and going like, oh, wait, that's me. Now you have a place to empower yourself and take responsibility for your own health. Hit up Dr. Aakriti. You're going to have all her contact information in the show notes. And if you loved this podcast episode, please like, subscribe, share it, share it, share it. You know good and well that some of your people are struggling, and this might just be the information they needed. And lastly, always give yourself some grace because you're still growing and you're still learning, and you don't have to be right all the time. And thanks for joining us on Healthy AF.